This is an instructional video teaching our patients how to clean their facelift incisions. First, I'll point out the facelift incision. There is one incision that's in front and behind the ear. It starts here, and this wonderful volunteer is 4 days out from her surgery. She had some lower eyelid surgery and laser, but the facelift incision starts here. It comes around the temporal hair tuft. It's hidden behind the hair. It's in front of the ear here. It's behind the tragus, which is right in front of the ear canal. These are dissolvable stitches in this portion. It's here around the earlobe. Go ahead and turn your head, my dear. It is on the back of the ear, and then it comes down and it's hidden in the hairline. So the first step for cleaning, and I like to tell patients this is a 3-step process. First step is to take either a wet Q-tip or 2x2 gauze. You gently dip it in some hydrogen peroxide and dab the incision. Now this patient has done a wonderful job of cleaning. You'll see a white fizzle at times if there's scab or dried blood. You can use a wet Q-tip. This is the wet step, the first step, or a dry Q-tip, or a wet gauze. And you just gently use this wet to kind of clean the incision. So the wet step with either a Q-tip or gauze. The second step is to pat dry. So you take a dry gauze or a dry Q-tip and just gently pat dry the areas that you've cleaned. You don't want to scrub, and make sure you pat dry everything. So last step is the ointment step, and you'll either take your glove or a Q-tip, and this is the ointment that you're going to use around the incisions is either going to be Aquaphor, vitamin A and D, or Stratamed. Usually we have our patients use the Stratamed on their incisions until the Stratamed runs out, and then transition to Aquaphor or vitamin A and D. And you essentially coat the incision generously. You want to keep the incision nice and moist. That moist medium gives you the best environment for an incision that heals wonderfully and becomes very hard to see over time. And you want to make sure you get the ointment on the back of the ear along that incision as well. And feel free to lather it on. It's kind of like frosting a cupcake, but that's how you clean your incisions. So 3 steps: wet step, dry step, and ointment step. The other incision that you'll be cleaning while you're cleaning your facelift incisions is the incision right under your chin. That's usually a 20 millimeter to 25 millimeter incision. You use the same steps: wet step, dry step, and ointment step to clean that incision. Once all your sutures come out, which come out over a period of 10 days after your surgery at different intervals, you don't have to clean anymore.